Today, we're talking about this is why everybody flies in. They want the parent roadmap. How do you prioritize and plan for the best support for your child, whether they're 37, they're 3, or 13? You have a kid who's struggling. It doesn't matter what the issue is. I'm going to share with you what I do. So let's get started. Let's talk a little bit about treatment failures, because honestly, most people have treatment failures, and you might be going to a really amazing practitioner, whether your kid has OCD, you have a PANS kid, you have a kid with complex ADHD, it doesn't matter. Genetic problems. I get all kinds of stuff, right? I could go through the list of the type of cases that we have. All of our cases generally are complex. Sometimes I get really simple, cases where a kid's a little anxious and they're young. And that's amazing. And I wish I had more people who jumped on things early before it snowballed, because nobody ever thinks that problem that you have early on is going to actually just continue and continue. Because a lot of times you ask for help and you might be gaslighted, or you're given the wrong information. That's what I see by well-meaning people. Nobody's being malicious. You're just not getting expert care. So unfortunately, you are probably very similar to even my own experience, where you constantly are looking for the right help and you just can't find it, right? In my next book, I'm actually going to be talking a lot about my own story. Chapter 1 is the bitches at the bus stop. I love to share that with people. You're going to have to read it to find out what it's about. But I know what it's like to be looking for things and to be struggling. So I want first to say treatment failures are not the end. Do they suck? Yeah, they do suck. Because you are in the belief, got my purple magic wand. I also have the glitter one, double one. We're in this belief that we're going to do this thing that's been recommended to us, maybe by somebody we care about or a trusted provider, and it's going to do the job. I'm here to tell you that most of the time it's not. If you're, watching any of my videos and you're a PANS family, I have a 5-pronged approach to PANS that really is almost applicable to many things. And in the sense that we have to take a multi-pronged approach, and we're not really telling people, right? So I'm going to walk you through some of the steps that I do and how you need to best plan, because I know you're overwhelmed, right? So 48% of parents are overwhelmed. 41% of parents are so overwhelmed they're almost non-functional, according to the U.S. Surgeon General. You're going to hear me repeat this all the time because it's true. I see it. I see this horrible shift in parents, and then it just makes you feel totally inadequate. And I just want you to know that you're not inadequate and you're doing an awesome job. So let's talk about science, and let's bring in the nervous system, and let's use biohacking, right? How do we use what we know about the brain and body to help your child overcome that anxiety, that, the attention problems, the rage, whatever the heck is going on? It doesn't matter, but it does. But there's a base to it, right? So when our child fails at a treatment, right, it doesn't mean they can't be helped. Let me say that again. So when your child fails at a treatment, OT, PT, psychotherapy, probably the biggest one, right? Reading instruction, social skills, it does not mean it can't be helped, right? What we have to do is recognize what the right approach is and think about timing and order, right? So there's the right treatment at the right time. I talk about that all the time. That is probably the biggest thing that I do, is that people come to us for our brain behavior reset program. Go to drroseann.com/help, fill out the solution matcher, and it's going to match you to the right solution for wherever you're at. But what most people are coming to me for is this strategy, right? Yes, they come to me for the amazing care. We offer, white glove, concierge level mental health care in a way that literally nobody else in the world is doing. So, and again, I won't be doing it forever. So, but I will pass the baton to some people. So, but that right treatment in the right order, right, is critical. So first of all, the first step is to identify what's the most urgent issue or issues, right? So just get out your iPhone in your notes section, or a sticky pad, or if you're like me, I carry a book that has the dates. Look at me, I can't do that. Has the date and the year on it, and they're always magenta because I love that color. My phone is too. And basically, you are gonna just take some notes, right? So you might say it's everything, Roseann. It's not everything. Okay. There is going to be some things that are most urgent, right? So what are the triggers? Start making a list. Here are the triggers. Here are the behaviors. And I'm going to tell you, you can't do that if you're not regulating yourself. So you have to take some regulation. Go back and listen to my comms episode in our comms protocol. And you have to be as detective-like as possible without being emotionally reactive. So just data collect, okay? You don't even have to interact. You can just data collect and start looking for patterns. But most urgently, you're going to really try to identify what's the biggest issue, the biggest issues that are really driving some of these behaviors, right? The other part that people do, right treatment, right time, is you can't do every treatment all at once. I mean, not unless you're working with somebody like me or some trusted provider. There are great providers. Again, I don't know anybody who does anything even close to what I'm doing. But a lot of times we say, oh my God, it's ADD. I must do Ritalin. I must do this. I must do that. Why? Who's managing that? You are the CEO of your child's physical and mental health, but what's the strategy? What's the order? Too many people go into things without really thinking about the strategy. They're like, I'm going to fix the problem. So, and we have to stop looking at our kids, their behavior, like they are the problem, because it's often layered and complex. Yes, there are problematic behaviors, but kids aren't bad. And they're often not misbehaving. They're often not doing this on purpose. And that's part of this whole, your family ecosystem creating a lot of things. So what is the most urgent thing is what I'm going to talk about is you've got to calm the brain first. So let's talk about that and why nervous system regulation matters. Because if you are not regulating that nervous system, nothing is going to stick. Your brain is not going to allow that learning to happen. It's not going to allow your child's attention to be great. It's not going to allow the body to heal itself, right? I'm rarely somebody who gets sick because I have like 14 million things that I have all the time. And I have my Calm PMF. I have all these different tools, but some stressful things happened to me. So what happened? I got sick, got a stomach bug. Again, those things typically don't happen to me, but when your system activates, right, it's normal life. You're going to activate sometimes. Yeah, I had my PMF. Yeah, I had things, but it was stressful. I could feel it in my body. I could feel my blood pressure rising. Kids don't have those words to tell you, and their stressors are vast, right? Maybe it's their learning environment. Maybe it's tension between you and your spouse over the kid's behavior. Maybe it's a death of a dog. There's so many factors. Some of them may be really apparent, and some of them might be so small that they're just continually activating that nervous system. So resetting the nervous system and calming the nervous system sets the stage for success. And it increases the efficacy, the effectiveness of whatever intervention you're doing, right? So let's talk about things like social skills therapy, right? Social skills are really hard to learn, right? Because they are implicit. They are not explicit. We don't say, okay, in reading, here are the things you must do. They're very explicit. You have to have, your vowels. You have to have these consonant combinations. You have to all that. Still really hard. Mom of a dyslexic married into a dyslexic family. But with social skills, it's all inferential. Ooh, what is that person's body language? Ooh, is their tone a little off? Sarcasm, all these little things. So it's a hard skill to learn. Now, if you have a very stressed child, because guess what? They're going into a social situation. They know it's stressful. It's hard for them. So they activate. And as they activate, they're then in a social skills class and they're supposed to learn. How are you going to learn? You're not. Now, once you start to regulate the nervous system, you pull it out of that sympathetic rev state and you move it down into a parasympathetic state. That's what we do in our brain behavior reset program. That's what our calm PMF does. Our magnesium helps to do that. There's lots of ways, but we do it with clinical needs. We guide you one-on-one in our program. That's what we do, and we do a really amazing job on it. But when you pull the nervous system down, and you might not even get into a parasympathetic state, but you create space for the stress of that social skills class, all of a sudden things start sticking because you're not going into fight, flight, or freeze. You're not going into the highest levels of sympathetic dominant, and you are able to learn. And then ideally, what we call generalize, apply those things, right? So it's sort of like when you're like, my gosh, I'm telling this kid all the time and he's just not getting it. Like his brother's 6 years younger and he's getting it. Well, your brother 6 years younger isn't activated. He doesn't have the same issues, probably, maybe, but probably not, right? And you can see those differences. Like when a child is regulated, they absorb because their brain and body will allow it, and that's why psychotherapy gets a bum rap. And yes, my theory on psychotherapy is a lot of bad therapists, a lot. 1/3 of them should have their license taken away. I'm telling you. But there's great therapists out there, but it gets a bum rap because people go in there thinking it's magic and that you go for a few sessions. People call up and they're like, we're going to come in every other week. This is when we used to do, straight therapy. We only work in a 6-month program. And we'd be like, we have to clinically tell you what you need, because people have a sense that there's some kind of magic that's going to happen. And again, when you're regulated, right? So in our brain behavior reset program, when people do therapy in conjunction with the nervous system regulation, they skyrocket. And pretty much everybody who comes here has done a boatload of therapy and it didn't stick because of that activation, right? So the learning increases, the confidence increases, your stress levels at home come down, there's a lot more peace, and it allows for the learning to occur, right? So in the same way, when you look back at your treatment failures, so a lot of what I do is actually do an assessment of really what worked, what didn't work, why didn't it work. And many times we find reasons why it didn't work. Number one, it's nervous system activation. Every time. It is part of what happens and why people aren't absorbing. Essentially, that's really what's happened. Their body and brain aren't going to allow for the absorption of that learning, that the effectiveness of these proven interventions for things like ADHD or dyslexia. I love working with dyslexics because a lot of my dyslexics can, have attention problems or even emotional issues because God, they feel terrible because they're smart and they know they can't read. But I just love to see them skyrocket because we regulate their nervous system. And a lot of dyslexics don't look dysregulated because they can be very hard workers. And then you get to see their amplification of their reading when we have the right reading intervention at the same time. I mean, that's critical. We can't just expect, inappropriate program or intervention to work. You need the regulation plus the right intervention. But what I do is I go back and I look and I say, why didn't that work? And what can we do? How can we bring this in now once we regulate that nervous system, right? And again, what are ways that we are proven ways that we use in our program? We use neurofeedback, we use PEMF, we use supplements, we use actual different physical activities and exercises. We work on co-regulation with mom and dad. We help mom and dad align and see the problem the same way because that creates a lot of conflict. 80% of our parents are not in alignment with how they view the problem or the treatment. And this is what happens to couples, because it's murky and you're both trying to figure this out together and you don't have proper guidance, or you've gotten gaslighted, or, you've spent a lot on different interventions, you've tried a lot. And so then it just creates conflict, and it is normal. And there's a way to correct that. And you have to work with people who understand that and can help you get into alignment. It's not going to magically happen. I'm married 30 years next year, right? There are days where you hate each other's guts. And then you have to work through it, right? That's how you stay married, and you stay a calm, regulated force for your dysregulated kids, because I have dysregulated kids and who have overcome those issues, right? So here's your next step. So number one, right? What are you going to do first, peeps? You're going to look at what the top issue or issues are. Very, very critical. Try to do 3 or less, because if you can make a whole list, but really start trying to be that parent detective, really look at what's going on. And you can certainly make a separate list of triggers and think about interventions, think about why they did or didn't work. And then think about what are the next steps I'm going to do, right? Now, getting personalized support is critical. Like in our brain behavior reset program, everybody gets a tailored plan. You want to avoid the one trick pony, the person who's like, this is it. This is the only thing that works. That is never a good idea, because we need to provide an individual level of support for people. Yes, I'm the saying that nervous system regulation is essential. But what I'm also saying to you is there are many ways to regulate, right? So when I was feeling dysregulated last week, I was like, well, you're not praying. You didn't pray once this week. You didn't light your candles. That really resets me. There are a lot of little things that I do that really bring regulation to my nervous system. And I had to look at that, right? So a lot of times in those personalized approaches, it's important to really find an aligned provider with your values and somebody who has really clinical experience. Please avoid unqualified health coaches. There are 128,000 health coaches in the US, and I'm not saying they're bad. I love health coaches. We have health coaches on our team, but they don't have clinical experience. And you need to be very careful. There are many false gurus, and we need to follow the science, right? So science says we can regulate the nervous system, and we can regulate it without medication. And if you're really looking for lasting change, that is how you do it. There's no magic bullet. And I hope that if you feel so frustrated and worried and sad that these interventions haven't worked for you, I hope this opened your mind to maybe it was the wrong intervention at the wrong time. Maybe it was the right intervention at the wrong time. And I don't want you to feel like your kid isn't somebody who they can't be helped. You just need to get to that right step. You can go to drroseann.com/help, and you can fill out this amazing solution matcher, which is going to guide you to that right solution for where you're at. And just remember, again, like, don't get lost in the overwhelm and analysis paralysis, right? I always say that Einstein says the definition of insanity is to do the same thing over and over and expect a different result. So don't keep spinning your wheels. Take action. And I hope you do that. And you can do that by going to drroseann.com/help. Bye, everybody.